There's data showing, for example, that people are reluctant to fully disclose to experts. So we know that when coaches are part of primary care practices, they will disclose to the coach. And in some of these practices, the coaches are referred to as the friends of the patients, the concierge,
Huh.
the guides, the key communicators. So they will disclose, oh, they went off the supplements, or they're not complying with the medication. And they are very honest with the coach, whereas they're not, because they're often ashamed, they're afraid of being judged. So the other point that I think, so I again want to be clear that coaches they're not licensed providers, and they do not provide a diagnosis or a treatment plan. So if somebody is talking with a coach, the coach is not going to write in the chart depression. They're not going to have that code to diagnose somebody as depressed, bipolar, anxiety disorder. And what I have seen happen when I was practicing is that people will take this label, and it is now a sign that they wear. And they often have been told, you have a clinical imbalance, this is a disease. And so they are seeing themselves, I'm a depressed person, I'm an anxious person. The diagnosis is front and center and becomes key to their identity. And it's often very hard then to get better, because they're not focusing on what's good. They're not seeing themselves, the parts where they are functioning normally. They are hyper-focused on the depression, the anxiety, whatever that diagnosis is. I'm bipolar. And that is, again, it's their front and center. And it shapes their behavior and their emotions. When you clear that and focus on the commonality, but also focus on their strengths, we do that in positive psychology, then they have hope. And they're also starting to normalize their feelings. And when they do that, then they're not catastrophizing. They're not as likely to then get up to a level that is more serious. But I love that group that you were describing, because that is exactly right. It is not either or. And that when we train our coaches, we teach them how to refer, when to refer. When you are with somebody, for example, if somebody is voicing suicidal ideation, well, what are the steps to take? How do you make a referral? How do you ensure that the person's followed up? And then you don't have to stop seeing them. You don't have to fear or be afraid that you are in over your head here. Because coaches, what do? They're listeners. They're trained to listen, to accept someone where they're at. And just sitting and listening to someone, if they said nothing in the session, that alone, just the sense that they're there with them, that person feels heard and understood, now that's healing.
Yeah. Well, yeah, I see that. So, I guess one of the things that I wanted to share as well is that, something that I've realized this year is that, all of integrative, functional, lifestyle medicine is all built on this foundation of the idea that the patient will do something new. And, I guess one of the things that I've come to realize is that if you don't have that person, and I love the way you said, the friend or the guide, even changing the name, the care coordinator, someone who the person will be honest with, because I just see, when I was really honest with myself about the clinics that I helped and supported over, let's say, a decade, before I started working on this group project, I just felt like many times patients were coming in, getting an incredible workup, and then either starting and losing steam because it was really overcomplicated, or just that it was like too intimidating to start off, or there was just like such a big gap between where they were now and what they were being expected to do by the provider, that like it just never happened. And I wonder, now that I've seen clinics that have that kind of role that you're talking about, and even been providing that sort of role here with these groups, I just recognize that this is absolutely crucial to the care team of the future.
That is so well said. And the coach is the key communicator. They are experts in rapport building. They're experts in listening. And when you feel heard, when you feel like you have someone on your side, especially if you are a patient in a very large, busy practice, one of those where they might have 30 providers and a huge team, and often getting through communicating your needs, or even things like you get a bill and you don't understand what it's for or think you've been overcharged. So Dr. Cheng Rong talks about this a lot, that the coach in practice, it works both ways. They are advocates for the patient. They are also communicators the other way. So they can help people understand, they can educate people. Why did the doctor prescribe this? Why was this charge made? And they do it in a way because of their training, because they are health coaches, because it is totally a client-centered approach that they are trained in. They're not going to give that patient the same response that the office manager might, or the billing person, where it might be unintentionally a curt response and they don't feel heard, and they don't feel satisfied. And then they might give a negative Yelp review. And Cheng talks about, like, that's a great reason to have a coach, because they're going to help with that. They're going to help people have a very favorable outlook about the practice. And there's some studies that have shown that when you have a coach in your practice, you are more likely to get referrals. They're going to refer their friends, their relatives, because they'll feel much more satisfied with the care that they received. Why? Because they feel listened to, heard, understood.
Yeah. Well, look, I want to look a little bit to the future now, because obviously this has been a year of growth, and there's been a huge growth in the number of companies that are looking for coaches and the use of coaching. I'm excited about that, but I also know that one of the common questions has always been, well, how do I pay for the coach, right? And so I think there's starting to be some models, like obviously in cash. It's just, you have to work out a way to charge, and you can add a cost in, or you can have it be part of your package. And we've talked about that for years. But one of the things that's getting me quite excited is, obviously with Heal Community, we found out a way to have coaching be paid for on insurance one way or another. And that's by doing sort of a roundabout, by monetizing the groups through provider visits, and then shunting some of that money to the coaches for the coaching work, which is really what's moving the needle. But my understanding is that that coming soon, there could be codes that are dedicated for coaching. And as I understand it now, there are codes today that are for coaching. They're just not paid. But from my inside sources, and maybe you have better sources than I do, that like maybe 2023 or possibly 2024 could see a significant change in how coaching is valued by the payer system.
Yeah, so there are significant advancements. One of the most significant happened, I believe it was April of either 2020 or 2021. The coaching community, the coaching profession, is now a taxonomy code. That's very important, because that means that you have a special number. It identifies the coaching, health coaching, as a profession, and that you can put that on a claim. Now, the CPT, that's the procedural codes that are used if you're going to submit a claim. What procedure, what happened? And health coaching is now having a series of codes. They're both individual and group codes that are transitional. What does that mean? It means that they've not made that transition. They've not been bumped up to category 1. They're category 3, meaning that they are watching. So the bodies that are looking at this, they're tracking data and seeing how many people are actually using these claims. And when there are significant numbers, so it's basically, think of it as like it's trending. Coaching is trending. They're looking at it and saying, if it's popular enough, we'll bump it up, and we'll bump it up to category 1. And yes, it's looking very promising. That this is thanks to the National Board for Health and Wellness Coaching. So they're really the ones making coaching reputable. Before the board had those standards, anybody could start a coaching school and have a weekend course, and anyone could hang up with, oh, I'm a health coach. But there were no standards. So now, like, we are an approved school, and our graduates that then can sit for their exam. That's the gold standard. They're National Board Certified Health and Wellness Coaches. And when we do have the code category 1, meaning that reimbursement will be possible, you will need to be board certified in order to use those codes. will this mean? Well, we know in the insurance world, just having the code doesn't mean that you'll be reimbursed. Each payer has different procedures and rules. Medicare is different, but we know, especially Medicare, they want health coaching. They are encouraging this. Coaches can be involved in the yearly wellness visits. They can also be involved as data managers for remote monitoring. If you have patients and they're wearing continuous glucose monitors, I love mine, and any data that is being collected on these home monitoring devices, the coach can be monitoring as the communicator, both to the patient and the practice. That's another way that coaching, if you're a practice, you can consider health coaching for reimbursement. We've also seen corporations know that we've got quiet quitting now, which used to be called presenteeism. We know that when health coaches are engaged, people feel better. They feel like the company cares about them, and they're also more committed in terms of better work, finding meaning and purpose in their work.
Yeah. Well, I want to give a shout out, Sandy, because, obviously when we started Heal Community, we started hiring FMCA coaches. And part of what I wanted to share today is, if you are interested in health coaching or hiring a coach, you can go to Functional Medicine Coaching Academy. If you want to follow the link at goevomed.com/FMCA, you can find out about if you want to go through the coaching program. But I would just say, we have hired almost exclusively from your school so far. And I would say the talent that we've managed to get into our groups has been amazing. Our head coach, Elizabeth, who came through that program, came to us also with an MPH, and not only runs the coaching, but also the data, and is a whiz, such a whiz. And we're so grateful for her. We put her in some pretty sticky situations like mental health clinic, and she just flew through it, was totally comfortable, and now is, building a great sort of team of coaches around her and building, great standards. And I would say, one of the things that's been exciting for this year is it sort of set us up for, I think, something, really transformational. You mentioned Dr. Rawn earlier, but I just want to share a quick story about that. Dr. Rawn and I have been friends for years, and he was the one that really first sort of clued me into the fact that, one, virtual coaching was really worked, and two, virtual group coaching, and two, that most clinics would never be able to really execute it because it's tricky to do it on insurance and get all the pieces together. And he was like, look, if you could do it for them, there'd be a great opportunity there. And that's what Heal Community became. So earlier, he and I have been sort of going back and forth, and I've been sharing with him some of the things that we've been up to, things that we've been learning, just sharing best practices. So earlier this year, in the middle of the summer, the state of Texas has a problem. And the state of Texas has a problem that if you have Medicare or Medicaid and you just happen to live in one of the rural states, there's no doctors, right? There's no doctors. The ratio can be over 100,000 patients to one doctor. And so it's impossible to get an appointment. So the state of Texas went to Memorial Hermann ACO, which is what Cheng's part of, and basically looked at the matrix. Who gets the best outcomes at the lowest cost? Let's take a look. And guess what? Cheng is in the mix there. Why? Because he's doing groups, because he's using coaches, all the reasons that we've just been speaking about, and the costs are lower. So they come to Cheng and they say, hey, we have all these people. Do you have any ideas of how we could, go about solving this problem? And so he called me and he said, hey, we got this opportunity. It's going to be a kind of a heavy lift for me to onboard these patients from physician city databases, because I'm going to have to onboard them into my EHR. I'm going to have to scale the provider side of it because there's a provider side on our side. So I'm going to have to hire and train these providers and have them working in the whole system. And we're going to have to bill a lot of Medicare and Medicaid because there's a lot of people out there. Most clinics in functional medicine are dealing with like 10 at a time, or at very most like 100 patients at a time. And this was like 55,000 patients. So, in that moment, he was like, look, I've got to do this. What I need is someone who can take care of, can you run the groups? And I was like, yeah, definitely we can. So what I'm excited to share is that we're off and running on that contract, and it's really exciting, and and the outcomes have been great. Our coaches have been great. We're definitely going to be hiring more coaches in 2023 as this continues to ramp up. But I guess I just wanted to share that, like, we wouldn't have been able to get where we are without the coaches that you've given us and that we've hired from you, and also that, like, I don't think what we're even talking about would have been possible a couple of years ago. And that's why, just the progress that everyone's making, to start small and to learn as you go and to build systems that scale is now opening up this amazing opportunity to have virtual coaching groups be like the first line therapy for people who have never experienced functional medicine, who have never experienced lifestyle medicine, only have Medicare and Medicaid, and live in the state of Texas. And to me, it's pretty exciting because I feel like it's everything that we've just been talking about for the last half an hour in actualization. And the truth is, this problem that the state of Texas is facing is the same in every state. Every state has lost doctors, rural doctors. Every state has a physician shortage. So I'm excited about the future, and I'm excited about a coach first operating system of medicine. I've been thinking about this for 8 years since we started the Functional Forum, and I was working with Gabe, who was a coach in a functional medicine office in 2007. And so I guess I just wanted to say thank you for what you've done to create this network of coaches that are well suited for this work. And I'm excited what 2023 will hold as we sort of march forward to this together.
I'm so excited to partner with you, to train the health coaches. We need you to be health coaches. We need, someone once said, we need 100,000 health coaches. I heard that a few weeks ago to meet the demand. The loss of doctors, the loss of nurses. We're rebuilding a better healthcare system, and with a partnership with Heal Community, Texas First, and now the rest of the world for virtual group coaching with FMCA coaches.